One of the most common questions patients ask me is, Doctor, am I ovulating? Especially when someone is trying to get pregnant. These questions comes up a lot. Questions like, is my ovary even releasing eggs? Or is ovulation the reason I am not getting pregnant? So in this video, I want to explain simple practical ways to know whether or not you are ovulating. There are physical signs your body shows you, tests you can do at home, and tests to be done in a clinic. For the physical signs, the first one we'll talk about is changes in cervical mucus. Cervical mucus is the natural discharge produced by the cervix. The amount and consistency change throughout the cycle depending on hormones. Around ovulation, estrogen is at its highest. Cervical mucus becomes thin, slippery, and stretchy. Many people describe it as raw egg white. This type of mucus helps sperm survive and helps sperm travel up to meet the egg. Now, after ovulation, when progesterone dominates, cervical mucus becomes thicker, sticky, or dry. This discharge is not very sperm friendly. The second sign is Mittelschmerz, which is middle of the cycle pain. It is a German word that literally means middle pain. Some people feel a mild ache or pressure on one side of the lower abdomen. This happens because when the egg is released from the ovary, a small amount of fluid is released into the pelvis. This fluid can irritate nearby tissues. Not everyone feels this pain, but some women do, and it is perfectly normal. The third sign is increased interest in intimacy. As estrogen peaks around ovulation, many people notice increased libido, increased interest in intimacy. Your body is biologically encouraging reproduction, and it is honestly amazing how coordinated this all is. Not everyone experiences all three signs, and that is okay, but being aware of them helps you understand your cycle better. So let's talk about tests to be done at home. The first one is basal body temperature. Basal body temperature is your resting temperature, taken first thing in the morning before getting out of bed and before talking, walking, or moving around. After ovulation, progesterone raises body temperature. Your temperature increases by about zero point 0.3 to zero point 0.5 degrees Celsius. This method helps you confirm ovulation has already happened. It is important to know that the basal body temperature is not reliable for timing intercourse if you are trying to conceive. Many people wait for the temperature rise before having intercourse, and that is too late. The fertile window is the 5 days before ovulation and the day of ovulation itself. Now, basal body temperature is best used to learn your ovulation pattern over several months, predict future cycles, and identify possible pregnancy if temperature stays elevated. If your basal body temperature chart is chaotic or shows no clear rise, it could mean incorrect measuring or irregular ovulation, which is a reason to see a doctor. The second test that can be done at home is ovulation predictor kits. These look like pregnancy tests, but they detect luteinizing hormone. Luteinizing hormone is released by the pituitary gland and triggers ovulation. When you see a positive test, it means you will ovulate in 24 to 36 hours. If you could only pick one day to have intercourse, go for the day of your first positive test. It is the best day. Now, it is important to start testing about a week before expected ovulation day. Also, don't wait and stop intercourse while testing, and have intercourse during that week and when the test turns positive. Ovulation predictor kits can be confusing in people with polycystic ovarian syndrome because LH levels may already be high, false positives are common, and ovulation may be irregular. So, if ovulation predictor kits stress you out, they may not be the best method for you. Now, let's talk about tests done in the clinic. The first one is a transvaginal ultrasound. This ultrasound can show a growing follicle before ovulation or a structure called the corpus luteum after ovulation has occurred. This is how it works. A doctor uses a probe to visualize the ovaries, measure the size of the follicles, and also check the thickness of the uterine lining. This is the best method for predicting ovulation because it provides immediate, direct visual confirmation of a dominant follicle just before it ruptures. The second test is blood luteinizing hormone test. A lab blood test measures the LH surge that triggers ovulation. It is more precise than home kits, and LH surge typically precedes ovulation by 12 to 36 hours. Also, blood tests for progesterone can be done, but it is a confirmatory test. Progesterone should be low before ovulation and elevated after ovulation. So, if progesterone level is about 3 nanogram per ml in the second half of the cycle, it means you have already ovulated. Now, quickly, let's recap what we have learned so far. You can know if you are ovulating by physical signs such as cervical mucus, mid-cycle pain, increased libido. Home tests like basal body temperature, ovulation kits, and clinic tests like the ultrasound and luteinizing hormone blood test. Finally, ovulation tracking can feel overwhelming, but it doesn't have to be perfect. If your cycles are regular, you are probably ovulating. If things are irregular or confusing, that is when medical guidance really helps. If this video helped you, please like, share, drop your comments, and subscribe for more women's health videos. And until next time, stay healthy and be kind to yourself.